Okay, Professor Courtney, so I'm here with Jen. And we're gonna do my medication administration mastery. So just showing you around the room, we're in Jen's music room. All kinds of stuff in here. Avery.
Oh my goodness.
Jen's daughter is super interested in what we're doing. Sorry about that.
Ouch.
Go. Okay. All right. So just showing you my desk here. I do have some things set up, and then against the wall here, I have my scenario, my orders, and my MAR. Okay. So I'm gonna try to put myself down here for you so you can see me. Think you can see me here? Okay. So the first thing I'm gonna do is take a look at the scenario here. So I have Emily Johnson. She's a 76-year-old female from Pikeville. She's a grandmother of 6, works part-time at the local library. She has type 1 diabetes and an ear infection of the left ear. She also needs a flu shot for the season. On a previous assessment, the nurse could pinch less than 2 inches by her umbilicus. I see here that she is 68 kgs, which is about 149 pounds. I also see that she has allergies to morphine and codeine. So the first thing that we have ordered is we have Fluzone 0.5 milliliters to be given intramuscularly in the deltoid. We also have 15 units of Humulin N insulin to be given subcutaneously, and we also have Orfloxacin, 2 drops to be given in the affected ear BID for 7 days. So I would go ahead and start by looking in the Pyxis and verify my orders. So I have Fluzone quadrivalent inactivated influenza vaccine, 0.5 milliliters to be given intramuscularly now to the patient Emily Johnson, date of birth 12/16, 1942. And she has allergies to morphine and codeine. These should not interfere with her influenza vaccine. So I would go ahead and I would wash my hands to get ready, just to be extra sterile. And I can put gloves on. I would go ahead, look in the Pyxis, and get my Fluzone vaccine. I don't know if you can see this, but this is Fluzone. I see that it expires, it's a multi-dose vial, and there is 0.5 mLs per dose. It expires December 30th of 2050. So I would set that down. And again, this is the Fluzone for Emily Johnson. 0.5 ml to be given IM, date of birth 12/16 of 1942. And it doesn't give me a birthday, so I'm saying 1942 just to make up a arbitrary number. Okay, so the first thing that I would do would be to get a 1 ml syringe because it's a 0.5 ml. So I have my 1 ml syringe. It is already opened, but just because we practiced with it, I would make sure that it is not expired. I would also get some alcohol wipes, and I would get my 23 gauge by 1 inch needle based on her size. That should be a long enough needle for her to be given IM. And I would make sure that it is not expired as well. So it expires 10/31 of 2023, and this expires, has it here, 4/3 of 2022. So I would open both of these, maintaining a sterile environment. These gloves are a little too big for me. Maybe. Okay, so I have them open. And I would go ahead and clean off the top of my medication. So I would grab my syringe, being careful not to touch the inside. And I would go ahead and grab my needle and attach them. And I can take my cap off with one hand, and I will carefully, being careful not to touch the inside here, draw back to 0.5 mLs. Okay, I don't know if you can see that there. 0.5 ml. This camera is not super clear, but 0.5 mLs. So I've already cleaned the top of this. I would take my needle, push down into the top here, turn it upside down. Well, actually, I'm sorry. I would push the air in first. Then I would turn it upside down and carefully, not touching the inside, draw back to 0.5 milliliters. I would take this out, and I would flick out my air bubbles. Stubborn one over here. There it goes. Now I would go ahead and safely recap my needle, one-handed, kind of chasing it around actually, it's my fault. Okay. I'll take that and pop it back on safely. So you can see I have my 0.5 ml. I would take a piece of tape and I would write Fluzone 0.5 ml. And I would tape it onto my syringe and place it to the side. So next, I know that I have to give 15 units of insulin. It's the Humulin N insulin subcutaneous daily. So I know that my patient is allergic to morphine and codeine. So those should not interfere. So I would go ahead and get my insulin Humulin N. So I have my insulin Humulin N here. And I would go ahead and wipe this off and set it to the side. I can take a look here also beforehand and notice that it expires December 20th of 2060. So I can wipe that off and leave that there. I would get an insulin syringe, and I see that this insulin syringe would technically be unopened like my other stuff. And I see that it expires 1 of 2020. So I would get a new insulin syringe. But I would open it and I would take it out of its package, making sure that it is sterile. So again, I'm checking 15 units of Humulin N subcutaneous daily. So I would take my syringe off. I would pull back to 15 units. Syringe is a little stubborn. Trying to make sure that I keep it at the right place without touching the inside. Okay, so I have my 15 units of air. Now, I would take my syringe, go ahead and stab it through the middle here, push in 15 units worth of air. I would turn it upside down, keeping careful to not touch the insides, and I would draw back to 15 units. Stubborn here. There we go. Okay, so take this out, flick out any air bubbles. And I would safely recap one-handed. A little bit there. And then I can show you, if this will snap on, my 15 units of insulin. So I would write on this piece of tape, 15 units. Of Humulin N. And I would tape my syringe. Being careful to not touch that inner part. Then I would also go ahead and grab my Floxin drops. So I would get them out of the Pyxis. I would check the dosage. This just says 2 drops in the affected ear, BID, for 7 days. So I would grab my Floxin drops. So then I would go ahead and do another med check. So I would have I'll start with my flu shot. Sticky. Okay, so I have quadrivalent inactivated influenza vaccine, Fluzone, 0.5 ml. IM to be given now in the deltoid for Emily Johnson, date of birth 12/16/1942. She has allergies to morphine and codeine, which shouldn't be an issue for this medication. I also have 15 units of Humulin N, and it's to be given sub-Q daily for Emily Johnson, date of birth 12/16/1942, and her allergies of morphine and codeine should not be a problem for this either. I also will have my Ofloxacin eardrops given 2 drops in the affected ear, BID, for 7 days for Emily Johnson, date of birth 12/16/1942. Her allergies of morphine and codeine should not interfere with this. So I take my gloves off. Maybe. Take my gloves off here. Sorry, my hands are sweaty. And I would wash my hands. So I gather all my medications. I would have my drops. And I would walk into my patient's room. So I'm going to knock on the door.
Come in.
Alrighty. Set my things down, scan the room for safety, make sure everything looks okay. I would go ahead and wash my hands. Hi, Miss Johnson. My name is Courtney. I'm going to be your nurse today. How are you?
Good, thank you.
Alrighty. Can you tell me where you are?
I'm at the hospital.
Okay. And can you tell me your name again?
Jen.
Emily.
Whiteman.
Yeah.
Emily Johnson.
Okay. Perfect. And can you tell me your date of birth?
June 6, 1942. I'm sorry.
12/16.
12/16.
She would have said the right information. Sorry about that. So I would wash my hands. Okay, Miss Johnson. So today we're going to give you your flu vaccine. We're going to give you your insulin, and we're also going to go ahead and give you your ear drops for your ear infection. Is that okay?
Yes.
Can you also, just establishing your level of consciousness, can you tell me what month it is?
It's August.
And can you tell me who the president is?
Trump.
Okay, so she's alert and oriented ×4. So we'll go ahead and get started. So I've washed my hands. So I'm going to check each medication against your orders. So tell me your name and date of birth again.
Emily Johnson.
Okay. 12/16.
12/16/1942.
Okay, and so this is for Fluzone, 0.5 ml. Getting that. Checking against your MAR. And just to be clear, you have allergies to
Morphine and codeine.
Correct. Okay, that's what we have in our system. So again, Fluzone is 0.5 milliliters to be given IM now for Emily Johnson. And your date of birth was 12/16/42.
Yes.
Okay, and can you tell me your date of birth and name one more time?
Emily Johnson, 12/16/1942.
Okay, and your allergies are?
Morphine and codeine.
Okay, and that is for your insulin, 15 units of insulin for your diabetes. And I have your eardrops here, and verify one more time for me.
Emily Johnson, 12/16/1942.
Okay, and your allergies to morphine and codeine. So none of these should interact with that, and this is for your Ofloxacin, 2 drops in the infected ear, BID for 7 days. So again, we have Fluzone, 0.5 ml. IM, we have your Humulin N insulin to be given 15 units subcutaneously daily, and we have your Ofloxacin 2 drops in the affected ear BID for 7 days, okay? So I'm gonna go ahead and start with your flu shot, is that okay?
Yes.
Okay, so I know I already said I washed my hands, but I could re-wash them because I touched things. Alrighty, and I'll go ahead and put on the gloves. Ms. Johnson, do you have a preference on which arm the medication goes into?
My right arm, please.
Your right arm, perfect. That's how we're facing. Alright, so I'm picking up my Fluzone here. Okay, so I'm feeling for her acromion process. So I'm gonna go about 2 to 3 fingers down from that, and I can feel kind of in the meatiest part of the deltoid. So I feel here. I would go ahead and clean her off in a circular motion. And I would fully let that dry, not blowing on it, just letting it dry. All right. So I would uncap my Fluzone, and using the Z-Trap method, I would go ahead and pull the skin to the side using my non-dominant hand. I would go in at a 90-degree angle. I would use my non-dominant hand to stabilize my needle, and I would push the medication in. I would take the needle out, use the safety recapping feature of the needle, and I would let the skin stay taut for 10 seconds. So I've safely recapped my needle here, and I would go ahead and set it to the side, and I can put a little piece of Band-Aid on there and leave that. Any too much discomfort there?
No, good.
Okay. Alrighty, so I'll leave that there. Okay, so now we're gonna take this off. So we're gonna give you your insulin injection. So how do you just hold that there for me? So verifying again, it's 15 units of Humulin in insulin subcutaneously. So do you have a preference on which side I give this medication to you on?
Last time it was here, so how about here?
Okay, so we'll do your right side. So I'll go ahead and take a look here. Okay, so I would, since I can pinch less than 2 inches, I would go in at a 45-degree angle. So I'm gonna clean you off here. Allowing this whole area to dry. Alrighty. Letting that dry. So I would uncap my needle. I would pinch, since it's less than 2 inches, I'm gonna go in at a 45-degree angle. So I would go in and push slowly, making sure not to touch the inside of my plunger. Take this out, let the skin go back to normal. Use my recapping feature of my needle. Never seen that before. And lay that down. Alrighty, too much discomfort there?
No.
Okay. Alrighty, so I'll take this from you. So the last thing we're gonna do, Ms. Johnson, is give you your eardrops. So again, it's the Ofloxacin eardrops. We're gonna do 2 in your affected ear, and you're receiving them twice a day for 7 days, okay? So I'll walk over, I have my drops. So I would have you tilt your head. I would take the lid off the dropper, and I would hold them about, I'm gonna have you tilt a little more, okay. I would hold the dropper about 1 centimeter above. I'm actually gonna use my non-dominant hand to do it because I'm gonna pull your pinna up and back to straighten the ear canal. 1 centimeter up, I would drop 1. Actually, beforehand, I would do an assessment to make sure, I would do an assessment to make sure that your ear canal is clean, there's no cerumen. I would remove it if there was, no redness or discharge or any obstruction, and it looks pink, it looks healthy, and the skin is intact. So then I would use my non-dominant hand to hold about 1 centimeter above. I would drop 1, and pulling the pinna up and back to straighten out the ear canal. I would drop 1, and I would drop 2. I would set it to the side, and I would gently massage the tragus just to ensure dispersion of the medication. Hold in here. Okay, and I'm gonna have you leave your head like that for just a minute, just to let the medication go in. And while you have your head like that, I will go ahead and take all my sharps, dispose of them in the sharps container. And then I would let you bring your head up back to normal. So I would take my gloves off, and I would wash my hands, clean up all my plastic. Ms. Johnson, do you have any questions for me?
I don't.
Okay. If you need anything, let me know. And are you comfortable? You have your call light?
Yes.
Okay. I'll be back in about 30 minutes to do a reassessment, okay?
Okay.
All right. Thank you. Okay, thanks.